are you today? Leah, where are you today? Very good. Okay, but do you know where you are? You're gonna say yes. I know where I am. Okay, so
I asked her both because I caught myself the first time.
the
I
second
started.
time I heard him say, "Do you know what today is?" Okay. What about the eyes? Everybody.
The accommodation, like, didn't you say to look at it and then look away? That might assess something else.
Right, started to look at Georgia.
He did do that, and then he did the conversion.
He did both. Yeah.
He didn't adjust the head of the bench.
Very good. Very
The
good.
head of the what?
The head of the
I
bench.
should have had him up.
Yeah.
Yeah, because accommodation, maybe you could tell because Leah has light eyes, but I couldn't, there's no way I could tell pupillary changes. Very good.
Good catch.
One more thing.
For the trigeminal nerve, isn't it here, here, and here? Not here. Or
It
is it
doesn't
any
matter.
three places?
Any three places.
Okay, I
And did
didn't
you
know.
want us to assess for mastication or no? Okay.
I mean, you can if you want to.
You said the sclera was clear.
And, okay, I didn't say white.
Unbelievable. We got it on. We could go back.
Yeah, we're
Revert.
gonna watch this.
Watch the videotape.
Okay, good.
Very good.
You guys
It was hard to tell if you were fully 18 inches away with accommodation and convergence. He wasn't, right?
I was like right here.
Yeah.
So I was like, she was looking at me, and I was like, that's why I put your hands out. Because it was actually right here, but then I pushed the bit more.
This is like 2 feet.
Very good.
Do you do it like by the knee, like
Yeah.
by like the
Yeah.
So go for the knee. Make sure it's far enough away.
Also, you said anything less than 35 is hypoactive. You should have said anything less than 5.
Did I say that?
I didn't get
What about the neck? We're good with the neck?
when he did Joe, he noted he didn't turn her head side to side, and I think it says turn the head to the
That's
side.
okay if you don't. I'm okay with that.
I want to see mine. I know in the book it talks about doing all this.
Range of motion?
Yeah, are we supposed to do that?
I don't care.
And that would be for cranial nerve 11, part of the. Yeah.
If you can do this, you probably can do that. Maybe. I don't care. Okay, when you auscultate for a brewery, is it a good thing or a bad thing?
It's a bad thing.
So you have to say no brewery noted.
Right.
Okay? You have to diagnose it. Okay? So I'm gonna ask the patient, take a deep breath, hold it, okay, let it out, and the other side, hold it, let it out, no brewery noted.
Same thing with the helmets, right?
Yeah, we'll get to that. Okay, skin turgor. What's a positive skin turgor?
Elasticity.
Elastic. Okay, good. So you have to say skin turgor is elastic. Very good. What does this mean here?
The capillary refill. You wanted me to write down
Thank
first.
you. Thank you. Okay, so capillary refill is good, less than 2 seconds. Brisk.
Brisk?
So the color returns in less than 2 seconds. So we call that brisk cap refill. Okay? You'll hear that with medical terminology when nurses are talking or nurses talking to doctors. Well, how's this cap refill? It's brisk. Brisk less than 2. You know? So learn the terminology. I know you know it, but... Okay. When he asked her to squeeze bilaterally in the upper and the lower extremities, he knows what, I think you know what to do.
You're looking for equal strength on both sides.
Very good. Okay. So you gotta say that.
There's an equal strength bilateral.
Very good. You said, okay, squeeze my hands. Okay, that's good strength. Okay, push against me. Okay, that's good. I know you know it's good, but you can't chart like that, right? It's good. Anybody else?
Did you wiggle the fingers?
Why do we do that?
Range of motion.
Oh, okay. That's what you're supposed to do. Do you want us to?
I don't care.
It helps me remember to do capillary. The Holman sign.
She saw that.
What is this?
Internal rotation of the wrist and external rotation of the wrist. But that's okay if you don't do that because he did supination and pronation, right?
And to the shoulder.
Let's still do range of motion.
Oh.
One more thing with range of motion. I like to hear the joint that you're using, okay? I know you know this is flexion, but this is flexion of the elbow. Elbow flexion. Elbow, shoulder flexion, okay? Good. I'm good there.
So when you, just a quick question. When we're abduction, do you want an abduction of the arm? Abduction of the shoulder, okay. And then for the leg, abduction of the hip? Okay.
We're not doing flexion extension of the hip, right?
You can if you want.
Okay.
I want to see a flexion extension of some joint, pick it, I don't care, right? Okay. Everybody else, the turning was very good. Pulses were good.
Common sign on both legs. Did he check both legs or did he say
You have to do that first.
Didn't say, like, she didn't say anything about pain, like, if you
Assess
say it's
Hellman's
negative.
again. Let me see.
Okay.
I think I missed
Bring
it.
it from the back of the knee and the foot, bring it up, turn this towards the body as you raise it up. You're looking for any signs of discomfort
Where?
in the leg. Check the deep vein combo.
Right, you are, for sure. It's going to be calf pain.
Okay.
So you're going to flex the knee, dorsiflex the foot. Do you have any pain in your calf? You really don't even have to ask, to be honest, because they're going to hit the ceiling in pain, usually.
Because you're not waiting for a response.
But yeah.
for return demo purposes, we asked, do you have any pain in your
Are we supposed to take the radial and brachial pulse at the same time?
No.
Or one at a time will be okay?
We're just
Or
feeling
can we
her
say,
strength,
can we
right?
do one and say, okay, do the same on the other? Or do you want us to actually go, like, feel the other side after?
I feel like when you practice it like that, to say, oh, I'm going to run over and do it on the other side, it's not good practice because then in the hospital, it doesn't register. So I'd rather you walk around.
And if we're checking for both, can we do it from one side? Like
Yes, you can.
we
for
can
sure.
for
So we can do both at the same time?
no,
Not at the
one
same
at a time, but just from the same side.
Oh,
Like,
no,
where
she get a switch
Oh,
here.
I see, okay.
Say it again.
I thought they did in the video. They checked both to make sure that I don't know why.
And
Both
they were
of the-
equal
yeah.
or something.
I don't know.
The only time if you were doing like a pulse deficit, you would do radius and apical at the same time.
Well, before you do the range of motion exercises for the lower extremities, don't you have to do the Homan sign first so you don't, like, yeah, like if they do have deep vein thrombosis, wouldn't you assess that before you start range of motion exercises?
It kind of does make sense.
So before the first assessment you do on the lower extremity would be Holman's, is what we just pretty much okay.
You can do pulses, cap refill.
Okay,
Assess the
but before
skin,
you start
and
moving the limb.
yeah, probably. I mean, would I mark off for that? Probably not. But it is good critical thinking. Good job.
Good job.
Yes, sir.